Good morning, AM KTEK. Delighted to be with you to spend some time talking to you about you and your business. I got a lot to cover on today's program, so I think I'm going to get straight to it with my good friend, the one and only Frank Granett. He is with a group called CAOOY.org. What do all those initials stand for? And talk about the partnership this group has with the Price of Business. Frank, welcome.
Yeah, thanks for being on again, Kevin. And Coalition Against Over-Medicating Our Youth, we're a nonprofit public education charity. And our mission, Kevin, and since you and I collaborated months ago, we're basically helping parents help their kids get back on right track with behavioral conditions such as ADHD prior to premature drug use, especially in the young child population. And, you know, Kevin, since we started, we've had prominent physicians across the country as well as healthcare professionals weighing in on what these causative risk factors are. And on our website, you know, the book, The American Epidemic, has an action plan to help parents get their kids back on track. And today's guest, Kevin, is a nationally regarded addiction medicine specialist. He's a physician from California. He's the lead addiction medicine specialist for those patients that come to their facility at Cliffside, Malibu in California to help these patients get back on track with his treatment process. And today we're going to go over Adderall especially, and these abuses with Adderall, especially on college campuses, and how Dr. Damon Raskins from California. Sir, thanks for being on today.
Well, thank you so much for having me. I appreciate it.
Doctor, why don't you start off by just kind of giving us an overview of your practice?
Sure. So I'm board certified in internal medicine and addiction medicine. I help people in my office as well as at Cliffside, Malibu, get off of many different kinds of drugs as well as alcohol. And Adderall is definitely in the mix when I see these patients.
Very good. Go ahead there, Frank.
Yeah, Dr. Raskin, and this is an epidemic now. This is called the academic doping, if you will, on the college campuses. And, you know, many college campuses and universities are starting to put in their own policies. Like, for example, University of California at Fresno has a policy now on the prescribing. It's no longer very easy to get a prescription for Adderall. There's more processes involved. But on your end, this is the end result, you know, when patients come to you with this type of, isn't it addiction with the alcohol and the Adderall? Or can you describe to our listeners how dangerous that combination could be?
Well, sure. It's not just the individual Adderall. And by the way, it's not just prescribing because especially kids in college, they'll get it from their friends. They'll get it out of medicine cabinets from other people that they're walking into dorms. They'll steal it out of people's gym bags. So we're seeing this epidemic, and we're seeing the Adderall not only mixed with alcohol, which of course can be very dangerous, but also mixed with benzodiazepine drugs like Valium and Xanax. And one goes up and one goes down, and this combination really exacerbates the potential for lethality and for morbidity and mortality. So we're seeing all kinds of problems. I see people right now coming into Cliffside, Malibu, taking Adderall and mixing it with cocaine, mixing it with other stimulants as well as methamphetamine. So it's this combination that really is the problem here.
Yeah. By the way, early on, I want you, Doctor, to go ahead and make sure you mention your website for people to get more information.
Sure. My website is www.damonraskinmd.com. That's DamonRaskinMD.com.
Go ahead, Frank.
And Dr. Raskin, you know, the stats speak for themselves in our country now. You know, within a 5-year period, there was approximately a 300-fold increase in emergency room visits just due to the Adderall, abuse of Adderall. And like you just commented, it's that combination with these other drugs that, especially, I just wanted to focus on our college kids for a moment. What can you relate to our listeners and parents out there and our businesses out there, because it's just not on college campuses, the abuse of Adderall with these other compounds. Are you seeing in your practice, as well as, the Cliffside Malibu Addiction Treatment Center, has this spiked in the last few years, or what's the stats on your end?
I definitely see a spike, and it's not only the mixture, but it's also the way that people are using it. I see people, crushing their medication, snorting their medication, injecting these medications. And so this potentiates, again, more problems, including heart irregularities. We're seeing emergency room visits, as you mentioned. And so, yes, I'm definitely seeing an increase in this and people coming into the facility as Adderall as part of the mix of the drugs that they're using. Absolutely. You know, the figures are, I'm sure you know them, but it's about 11% of our youth right now in the United States is on a stimulant drug for ADHD. It's craziness, the amount of overprescribing that's going on here to our youth.
Yeah, it seems like it's an epidemic, and it seems like it's like a genie out of the bottle, and it's certainly a difficult one to put back in. What kind of things are you encouraging your colleagues to do in the mental health field to try to reel this in?
Well, I think we really need to take a step back and look, do we really need to medicate these people? Are these adolescents really suffering from ADD, and is the medicine actually getting them ahead academically? And I think the answer is the studies show that although it may help them with some focus and attention, it's not really helping them get ahead academically. And there are alternatives, and that's the key. There are non-stimulant medications available for attention deficit disorder. There are behavior techniques and modifications and therapy that can be done. So we need to look at the alternatives and not just run to the prescription for drugs like Adderall.
So, Dr. Raskin, briefly, for our listeners, could you explain? Say you have a young adult that comes to your facility, and he's basically not just on the Adderall; it's this mixture that we're talking about. What do you do, or what's your intervention as an addiction medicine specialist? Can you take us through, or what somebody can expect, and how successful is that process for you? Just kind of briefly.
Sure.
The assessment and what you're doing forward.
When I get a patient that comes in, first you have to take a complete history. You have to really find out what they're doing. You have to also get some blood tests. You have to get a urine toxicology. Sometimes people aren't going to tell you exactly what they're taking. So I got to find out really what's in their system, and then I have to detoxify them, which means to comfortably make sure that they get off the medication safely. We want to make sure that especially drugs like Xanax and Valium, if you just stop them cold turkey, they may have seizures, for example. So you have to give them some other medications to ease their discomfort. They may be going through trouble with insomnia, trouble with fatigue, trouble with shakes and tremors and nausea. So we give them medications gently to help them through this process, and that can take, depending on what they're using, anywhere from 5 to 7 to 10 days. But beyond that, what we're trying to do then is to get to the root of the problem. Really, are they suffering from anxiety? Are they suffering from depression? And it's the therapy that really makes the important impression then as to what we should do next. So psychotherapy, medications to help them detox and get comfortable so that they can engage in the program that's available at Cliffside Malibu. And then what we do is we try to address if there are medications that need to be given to them for depression and anxiety, what can we give them that's going to be the least harmful and the most helpful?
Let me ask you, are you feeling more positive? I know that the work that Frank and I have been doing is not the only effort that's being done, but are you beginning to see a turnaround, or do you think that there's still this kind of a complacency that is continually moving us towards more and more drug usage?
I see it all. I see, doctors are becoming more aware of the problem, especially the epidemic of opiates, which is, a whole other ball of wax and can of worms that I won't open right now. But, we're getting more and more knowledge about the dangers of these medications. I'm trying to get the word out, and I think that people are starting to recognize that we shouldn't just, reflexively get all these youth on medications like Adderall. So I think it's coming around, but it's still obviously an epidemic and still something that we're going to continue to see for a long time to come.
Yeah, very good. We need to wrap it up with that. Frank, your final thoughts, plus make sure we get your website in.
Yeah, thanks, Dr. Raskin, for being on with us today. And Coalition Against Over-Medicating Our Youth is, with our program and our organization, along with Kevin and the Price of Business, and it is a business. It's a business model that is evolving now, and it's a marriage, if you will, between functional medicine as well as traditional medicine. And like Dr. Raskin said, there's these whole host of other interventions that we should be implementing going forward, especially in our young population out there across the country, to help them get on a behavioral health pathway, a more positive pathway before the use of premature drugs.
Yep. And the website?
And the website is CAOOY.org. And Dr. Raskins website is cliffsidemalibu.com, a premier addiction treatment center in California. Thanks again, Dr. Raskin.
Thank you very much.
Great segment. Thank you to both of you. I do want to remind you that the best content here, including this interview, and I'm sure Frank's going to include an article over at the national news website, usdailyreview.com. Make sure you check that out. Like it on Facebook, follow it on Twitter. Thanks, gentlemen. When we come back, more for you right here on The Price of Business.